My administration has proposed a new rule to prohibit Title X funding from going to any clinic that performs abortions.
The Trump-Pence administration has added Title X to their list of full frontal assaults against women's health care and against Planned Parenthood. Title X has been recently revamped by the Trump-Pence administration in such a way that it moves away from medically accurate information and evidence-based medicine to folk remedies, trying to gag Planned Parenthood and other healthcare providers from openly and honestly having conversations with patients about the full range of healthcare options that are available to them. That is the result of this gag order. It would prevent Planned Parenthood from even uttering the word abortion. A lot of people think that federal dollars are being used to pay for abortions. That's absolutely not correct.
Title X funding does have to be kept separate from abortion services. Nobody likes abortion. No woman wakes up in the morning excited to have one. No one gets pregnant hoping they're going to have an abortion. It's a decision that people come to thoughtfully and deeply. The bottom line is nobody wants to have an abortion, so the idea is to make it so they don't have to by offering them birth control and access to health care. Also, abortion is a very, very small part of what we do at Planned Parenthood.
A lot of people will not like Planned Parenthood because they offer abortion services, which is silly because that's not the only thing that they do. That's I think 3% of what they do maybe. And there's so many other greater things that they do that should be talked about.
Well Women Care, which would be the annual exam doing breast and paps, cervical cancer screening, see people for sexually transmitted infection diagnosis and screening and treatment and follow-up for that. And we see people for reproductive health care, which would include the birth control and pregnancy testing and options.
We provide hormone therapy for persons transitioning.
People may not understand how many men are patients of Planned Parenthood and how many services Planned Parenthood offers. STI screening is an obvious one. The ability to seek services regardless of income and the confidentiality make them very appealing to both men and women.
Reproductive and sexual health services are not just for people who identify as women. It is a right that everybody needs and requires for their well-being, for their peace of mind. It affects every single person in our country, not just women.
We see people who can't otherwise afford health care. We see people who come to us because they've come to us in the past and they've come to appreciate the care that we give. We see young people, old people, men, women, queer people, healthy people, ill people, happy people, and scared people. We see them all.
For many of our patients, Planned Parenthood is the only health care that they get.
In a rural state like Vermont, there's a real geographic barrier to health care. So without that Title X funding, I'm worried that people are going to be missing on their yearly appointments or missing cancer screenings or lapsing in their birth control, all of which have real obvious and dire consequences.
We're very concerned that people will go without health care. They'll go without sexually transmitted disease infection treatment, that we'll see outbreaks of gonorrhea and syphilis and other sexually transmitted diseases. We are concerned that we will see more unwanted pregnancies. We're concerned that this could lead to children being born in families and in situations where it will cause major suffering and ruin lives. People might even resort to really old-fashioned back alley methods of terminating their own abortions.
I don't really understand why it's the poor folks and the folks with less political clout that seem to be targeted by this. It seems to be an imposition of a moral authority that has no legs. Our job at Planned Parenthood is to give people all their options, tell them what those options mean for them, and let people decide themselves what's best. It's their decision, it's their life.
I was just in the bathroom and I saw this cool poster about, words that you think of when you think of Planned Parenthood, and one of them is empowerment. I do absolutely feel empowered. I feel supported when I'm sitting in these chairs, when I'm sitting in the clinics. And I'm only one of millions of people that rely on that care, that rely on that support and that compassion.
I'm very proud of the work that I do at Planned Parenthood. We're not going to let this administration win. We're pushing back. We invite everyone to push back with us.